Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Sinus bradycardia causes symptoms and treatment. Bradycardia is a heart rate that's slower than normal. There are two main types of bradycardia: sinus bradycardia and heart block. /r/n/r/n Sinus bradycardia is defined as a resting heart rate of under 60 beats per minute that arises from the sinus node, which sets the heart rhythm. Sinus bradycardia can be normal for some people, but it may need treatment if it causes symptoms. Heart block, an abnormal type of bradycardia, may lead to serious symptoms and outcomes. /r/n/r/n This article explains bradycardia symptoms and their causes. It discusses how bradycardia is diagnosed and how both types of heart rate problems are treated. /r/n/r/n The hearts of adults at rest normally beat between 60 and 100 times per minute. /r/n/r/n Sinus bradycardia is a slow heart rate that involves the sinoatrial, or sinus, node, often referred to as the heart's natural pacemaker. The sinus node is the part of the heart that produces electrical signals that trigger each heartbeat. /r/n/r/n At rest, the sinus node typically generates electrical impulses for a heart rate between 60 and 100 times per minute, which is a normal sinus rhythm. /r/n/r/n Sinus bradycardia is a heart rate between 50 to 60 beats per minute. While technically outside of the normal range, these values can be entirely normal for some people. A healthy body is very good at regulating the heart rate to support the body's functions. /r/n/r/n The term bradycardia is used to describe a heart rate that's slower than typical. Sinus bradycardia is a type of slow heart rate that originates from the sinus node of your heart. /r/n/r/n Physiological bradycardia is a form of sinus bradycardia. Among people who have it, including healthy young people and older people in good physical condition, their resting heart rate may hover in the 40s or 50s. People also have lower heart rates when sleeping. /r/n/r/n Slow heart rates without symptoms usually are no cause for concern. However, when the heart rate becomes too slow to pump enough blood, it needs treatment. Sinus bradycardia that produces symptoms is a sign you should seek medical care. /r/n/r/n Children have faster heart rates, but by age 10 the rate of 60 to 100 beats per minute, BPM, is the same as for nearly all adults. Athletes often have lower resting heart rates. What changes with age is the target heart rate when healthy people exercise. For someone in their 20s, that's 100 to 170 BPM. If you're in your 50s, it's 85 to 145 BPM. By age 70, it's 75 to 128. /r/n/r/n If the heart rate is abnormally slow, several of the body's organs may not function normally. A heart rate that is too slow results in various symptoms, including /r/n/r/n These symptoms worsen with exercise because the body's needs increase with exertion. However, symptoms may also be present when the body is at rest if bradycardia is severe. /r/n/r/n If bradycardia happens for an extended period of time without treatment, it can lead to complications such as /r/n/r/n If you have any symptoms of bradycardia, talk to your healthcare provider to determine the cause. Proper treatment can return the heart rate to normal. /r/n/r/n The risk of dying from bradycardia is relatively low when there are no symptoms. However, a case of symptomatic bradycardia may cause cardiac arrest if left untreated. /r/n/r/n It's important to know the dangers because sinus bradycardia can be serious. /r/n/r/n A slow heart rate that causes symptoms, such as chest pain or shortness of breath, requires medical attention. This can lead to life-threatening cardiac arrest. Over time, Sinus bradycardia also may cause high blood pressure. /r/n/r/n Early diagnosis and treatment are important. /r/n/r/n Several medical conditions can cause sinus bradycardia, including /r/n/r/n These causes of sinus bradycardia fall into two categories, /r/n/r/n Of the two, sinus node bradycardia is more common. /r/n/r/n When the sinus node produces electrical impulses at a relatively reduced rate, the heart rate becomes slow. Sinus bradycardia causes can be either transient, meaning that they don't last long, or persistent, which is more likely to require treatment. /r/n/r/n The second type of bradycardia is heart block. In contrast to sinus bradycardia, heart block is always an abnormal condition. /r/n/r/n Heart block occurs when the heart's electrical impulses are wholly or partially blocked as they travel from the heart's atria, upper chambers, to the ventriclesthe, lower chambers that pump blood out of the heart. A block between the atria and ventricles causes a change in how fast the heart beats. /r/n/r/n Partial blocks occur when the electrical signals to the heart are delayed or intermittently stopped. A complete block happens when the signals stop entirely. /r/n/r/n When the heart's ventricles don't get information from the sinus node about how fast to beat, they use information from another part of the heart between the atria and ventricles, called the AV node. This broken communication results in potentially dangerous bradycardia. /r/n/r/n As with abnormal sinus bradycardia, a heart block can be transient or persistent. /r/n/r/n Transient heart block can occur with certain conditions such as /r/n/r/n Persistent heart block can result from many conditions, including /r/n/r/n Since bradycardia can be caused by damage to the heart, certain health conditions and factors associated with heart disease may increase the risk of bradycardia, such as /r/n/r/n An electrocardiogram, ECG will show that a slow heart rate is present. ECG tests will help to determine whether a slow heart rate is due to sinus bradycardia or heart block. /r/n/r/n The healthcare provider will then determine whether the bradycardia is likely to be persistent or due to a transient, temporary, cause, such as an infection. This can often be determined by taking a careful medical history. /r/n/r/n If other tests are needed, they may include /r/n/r/n The treatment of slow heart rate depends on whether the cause is sinus bradycardia or heart block and whether it's reversible or not. Treatment may include lifestyle changes, medication changes, or an implanted device called a pacemaker. /r/n/r/n A physician might treat transient sinus bradycardia by recommending you avoid the kinds of conditions that trigger it. For example, treating sleep apnea or adjusting medications are some things that might resolve transient bradycardia. /r/n/r/n Persistent bradycardia can also be reversed if it is caused by /r/n/r/n In these cases, treating the underlying problem often takes care of the slow heart rate too. /r/n/r/n If sinus bradycardia is reversible or produces no symptoms, it can often be managed through regular medical checkups. /r/n/r/n When partial and complete heart blocks are persistent, your healthcare provider may recommend a permanent pacemaker. /r/n/r/n In some cases, healthcare providers will do a trial of a temporary pacemaker. For example, when a partial AV block is caused by a myocardial infarction, heart attack, using a temporary pacemaker can help healthcare providers determine if the block is permanent or reversible. /r/n/r/n How long it takes to feel better will depend on the treatment needed. You should start feeling better once medications to treat an underlying cause are working or once a temporary pacemaker is placed. If a permanent pacemaker is implanted, you can usually resume your normal activities within 4 weeks. R/n/r/n. If you have sinus bradycardia, you should see your healthcare provider annually. Call your provider if your symptoms change noticeably or if your symptoms start to affect your daily life and routine. R/n/r/n. You should seek immediate medical care if you experience R/n/r/n. Bradycardia is defined as a heart rate of fewer than 60 beats per minute. The hearts of adults at rest typically beat between 60 and 100 times per minute. R/n/r/n. A lower than normal heart rate poses no problem for many people unless certain symptoms appear. These symptoms include chest pain, dizziness, easy fatigue, and shortness of breath. Then it's time to consult a physician to determine the underlying cause. R/n/r/n. The general causes of bradycardia fall into two categories: sinus node-mediated, more common, and heart block. Treatment may involve correcting any underlying causes or implanting a pacemaker. R/n/r/n. Some studies suggest people with anxiety disorders have a higher risk of slow heart rates. Anxiety also is shown to be a predictor of cardiovascular disease and sudden cardiac death. Contact your healthcare provider if you are concerned about stress and anxiety affecting your health. R/n/r/n. In some cases, yes, but it will depend on the cause. Slow heart rates due to infection or inflammation can be treated. Medications can be changed if they lead to slow heart rates. Keep in mind that in some cases, sinus bradycardia is actually a sign of a well-conditioned heart. R/n/r/n. Get our printable guide for your next doctor's appointment to help you ask the right questions. R/n/r/n. Sign up for our Health Tip of the Day newsletter, and receive daily tips that will help you live your healthiest life. R/n/r/n. Thank you. Form.email for signing up. R/n/r/n. There was an error. Please try again. R/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.